Hi, my name is Lisa, and I'm going to be doing a head-to-toe assessment on my patient, Isabella, over here, and I'm going to be using a one-sided note card just to guide my assessment. So to start off with my assessment, I'm going to be walking into the door and greeting the patient. Knock, knock, knock.
Come in.
Hi, my name is Elisa. Wash your hands. I'll be taking care of you today. We're going to be doing a head-to-toe assessment. Would you like some privacy?
No.
All right, so I'm going to leave the door open. If you feel uncomfortable at any point during this assessment, just let me know and we'll stop. Sound good? Okay, perfect. So I'm going to start by asking you a few simple questions. Can you tell me your name?
Isabella.
And your last name?
Romanucci.
And your date of birth?
April 28th, 2001.
Wonderful. And then we're going to start with some easy questions or some tricky questions. Who's the president of the United States right now?
Trump.
Okay, where did you go to grade school?
St. Vincent's.
And what did you eat for breakfast this morning?
Nothing.
Oh, not good. Okay. And where are you at right now?
I'm at your house.
Okay, perfect. And about what month is it?
It is July.
Wonderful. So she's alert and oriented times 4. Some next questions I'm going to ask you is your blood pressure. Is it run normally, high or low, or normal? Normal is 120 over 80.
Normal.
Okay. So I know blood pressure is usually done in the cardiovascular part, and although I already did that, I'm just going to do it again so that I don't forget. So you can go ahead and relax your arm here. Takes a little bit of setting up. All right, now you're going to feel a nice little tight squeeze. All right, so yours is about 118 over 70, which is a normal blood pressure for you, so that's perfect. All right, next I'm also going to take your respiratory rate for a minute and your pulse for a minute, and I'm going to use my phone as the timer. So, here we go. It's going to be a full minute, so you can just relax. All right, halfway there. All right, now we're in the second minute, so I'm checking your respiratory rate. So on 2 minutes. Almost there. Okay, so our respiratory rate was 18, and then your pulse was 70, which is normal. All right, from there, I'm going to move on to your cerebellar assessment. So I'm going to let you get up and move around a little bit. So I'm going to have you stand by that window. And I'm going to have you just walk normally right to me. Wonderful. And now you can walk back. Perfect. So I'm looking at her gait, making sure she's walking straight, things like that. Okay, next thing I'm going to have you do is I'm going to have you walk heel to toe. Heel to toe in a straight line all the way to me. Good job. Perfect. And I'm going to have you do it all the way back. And I'm assessing like her balance, her coordination, which looks pretty good. Okay. After that, I'm going to check your Romberg and your pronator drip. So Romberg is you're going to close your eyes and put your hands by your side. And I'm going to be looking for any swing or any feeling like she's going to fall. Typically, when you test this, you want to be like this. Knowing her, I know she's not going to fall, but you should be prepared to catch them. Okay, you can open your eyes. Now you're going to do the pronator drip, which is basically putting your hands out in front of you like this. Closing your eyes. Same thing, you're looking for like a drifting of the hand. Okay, or any imbalance. And that looks good. Wonderful. Okay, so the next thing I'm going to test is your sensory, or your coordination and fine motor. So this is another fun test. So I'm going to have you go like this as fast as you can. Together. Good job. Keep going. All right, wonderful. Next, I'm going to have you touch each finger to your thumbs. Wonderful. Good job. So I'm looking for symmetry and that she can do it with both and that she's coordinated. Next thing I'm going to have you do is, if you want to balance or you can do it laying down, you're going to put your heel and rub it right at the front of your shin and back up. Perfect. So you got really good balance, and we'll do it the other side as well. Usually this is tested laying down. Okay, perfect. And then the last one I'm going to have you do here is you're going to touch your nose and then touch my finger. Are you ready? Mm-hmm. Touch your nose, touch my finger. Faster. Perfect. All right, now you're going to do it with the other hand. Touch your nose, touch my finger. Perfect. All right. And that ends that section of it. Okay, so next I'm going to move on to your sensory function. So you can sit down real quick for this one. So I'm going to have you close your eyes. And I want you to tell me if you feel where I'm touching you.
Above my eyebrows.
And is it equal on both sides?
Yes. On my arms.
And is it equal on both sides?
Yes. On my forearm.
Which one?
My left one.
Okay.
On my right forearm.
And are they equal? Or is one different?
They're equal now.
Okay. And one more time.
On my shins.
Okay.
Equal. On my thighs.
Okay. Beautiful. So that was good for that test. Next, I'm going to check your vibration on your big toe. So this can kind of be a little bit funny or ticklish. So I'm going to have you lay down with your feet over here. And I'm going to have you close your eyes. And you're going to tell me when you feel the vibration and when it stops.
Okay.
Okay? Ready? Close your eyes. Do you feel it?
Yes. It's not there.
Okay. Same thing on the other foot. You guys want to test both of them?
Feel it? No. Yes. No. Yes.
Good job. Okay, so that's perfect. All right, now while you're there, I'm going to move your toe up like this, and that's forward,
Okay.
backwards, side, and side. So you're going to tell me the position of your toe without looking at it. So close your eyes.
Okay.
Ready?
Forward. Backward. Forward.
Okay, perfect. Now we're going to do your other foot.
Forward. Side. Side.
That's perfect. So she knows the location of her great toe. All right, now you can sit back up again. All right, so I'm going to have you open your hand like this. And this is called graphesthesia. So I'm going to have you close your eyes and you're going to tell me what number that you feel me trace on your hand.
Okay.
Number, okay? Ready?
2.
Good. All right, now we're going to do the other hand real quick.
4.
Good. Okay. So she was able to do those tests and she did really well. Now Now we're going to do 2-point discrimination and then point location. So this has to do with 2-point discrimination is you're not going to look at where I'm touching you, but you're going to tell me if it's 2 points that I'm touching or 1 point.
Okay.
So you can close your eyes or look the other way and tell me if it's 2 or 1 points.
2. 2. 1. 2.
Perfect. Okay. We'll try it on your leg.
2. 2.
Good. Okay. Now for point discrimination, I am going to touch a limb or somewhere on your body, and you have to point in exactly the same spot. So you don't have to say anything, but just point in the right spot, okay?
Mm-hmm.
Ready? All right, good job. All right, so those are all intact, so she looks really good in those aspects. The next thing I am going to do is your muscle strength. So the first thing I'm going to have you do is squeeze my fingers as hard as you can. They say you get more money the harder you squeeze. Really good. Okay, good. All right. I know this is not part of the test but I'm just going to include it just to make it more thorough. But I'm going to check your range of motion in your neck first. So I'm kind of like looking at the joints, checking for swelling, usually like assessing, so palpating. And I'm going to have you flex your neck, extend all the way back. I can put it straight. Now I'm going to check rotation, so right, left, perfect, and then bend and bend. Okay, so her range of motion, her neck is intact. Next, we're going to look at the range of motion in her shoulders. You can stand up for this if you want, or you can stay seated. So I'm going to have you extend, or flex, that's flex.
Okay.
Flex, hyperextend. Wonderful. Now you're going to abduct. Okay. And then I'm going to check the range of motion or the her shoulder to check for like any issues with her shoulder, like rotator cuff or like impingement syndrome. So what I'm going to have you do is I'm going to have you spin your arm like this. So this is called the Neers test with your thumb pointing to the bottom. And then as I touch your scapula back here, I'm going to have you put your arm over your head like this. And there's no pain?
No.
Okay. Just a little bit of cracking. All right, so let's do the same thing with this one. Put your arm over your head. Good job. Okay, now I'm going to check your elbows. Same thing, looking for swelling, just assessing them. Now we're going to do flex, extend, supinate, pronate. Perfect, so the range of motion is intact. This isn't on the test out either, but I'm just going to add it anyways. I think this is called the Frames test. And I'm going to have you... Someone holds her elbow, and I'm gonna have you try to pull your wrist forward as I push it down. So go ahead, push it against me. Perfect. And no pain or anything in your elbow, correct? So that's good. All right. Next thing I'm gonna do is I'm gonna be checking your wrist. So good, assessing for any swelling, if there's any pain there. Next thing I'm gonna do is I'm gonna have you flex them, extend, put them back. Then you can ulnar or radial deviate, ulnar deviate. Perfect. Okay, and then for this one, I'm going to have you do Fallon's test. So I'm going to have you go like this, and I'm going to have you hold it for like 30 seconds. Usually like 30 to 60 seconds. And at that point, if she had any like carpal tunnel syndrome, she would be having some pain or some tingling and would not be able to hold her hands together at that point. Okay, next we're going to do your hips. So while you're standing, I'll just have you flex and extend. So you're going to flex and then hyperextend. Perfect. Now you're going to abduct to the side and adduct. Okay, perfect. All right, and I'm going to have you lay down, and this test is called the Thomas test. So I'm going to have you pick up one of your knees and bring it towards your chest, and at the same time, I'm going to make sure, yeah, you can just hold it towards your chest. I'm making sure that her other hip is still on the bed and that it has not moved upwards. Sometimes if they have injuries, their hip will come up off the bed, or they'll have pain, or they'll be compensating somehow. So she looks really good, and she passed the Thomas test, so that's negative. Next thing is your knees. So you can sit up if you want. All right, so the next thing is your knee. Okay, so for this one, I'm going to have you stand up to do the range of motion real quick. So you're going to do flex, and you can hold on to me. And hopefully you should have something there. And you're going to extend it forward. Okay, perfect. And that's pretty much the only thing your knee can do. So then I'm going to have you lay back on the bed, and we're going to be checking all aspects of your knee. So we're going to start with your anterior drawer, your posterior drawer, then we're going to check your MCL and your LCL, and then your meniscus. So I'm going to have you bend one of your knees. Typically you need to do it on both sides, but for the purposes of this, I'm just going to do it on one. So for the anterior drawer test, what you do is you have the examiner sit on the foot. You're obviously assessing the knee before you do anything. If there's any pain, you need to let me know. So for the anterior drawer test, you're going to be pulling her knee forward, and you shouldn't see any movement of her patella coming forward. If you do see movement, then that could indicate some ACL issue. All right, so same thing with the same knee. I'm going to be pushing it backwards and doing the posterior drawer test. Again, there's no movement here, so there's no PCL issue there either. To check the ACL or the LCL and the MCL, you're going to do the valgus and the varus tests, and that is basically just manipulating the knee in a bend motion. So the first one we're going to do is the valgus test. So what I'm going to do is I'm going to push outwards on her thigh here and inwards on her shin. And there really shouldn't be much movement there. Are you okay there?
Yeah, it tickles.
Oh, okay. All right, and then the opposite is, so that was the varus test. The valgus test is, we're going to be pushing inward on her. Did I do that already? Well, okay, we'll just do that again. Valgus test is going to be pushing outward, so we did that. Okay, pushing inward is the vargus test with the G, and there shouldn't be any like movement or spaces in the medial side of the knee or the lateral side of the knee, which they were not for her. The last thing I'm going to do is check for any meniscus tears, and this can be done McBurney's and Apley's test. So I'm going to do Apley's test. So I'm going to have you just get on your stomach. Yeah.
Same thing.
Yeah, and I'm just going to, so what I'm going to do is I'm going to lift her knee, and you're going to kind of do like a grinding motion, but you're also going to make sure that you're holding her leg in place. So you're going to go outwards, and this should usually elicit pain, or there should be some grinding or popping or going on in the knee. Nothing is wrong with your meniscus, so that's perfect. All right, so while you're there, you can flip back over. All right, and your range of motion in your feet, you're going to push down on my hands, push, 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 and I'll push up on my hands. All right, her plantar flexion and her dorsiflexion are intact. Next thing I'm going to do is I'm going to write a J. All right, so her foot obviously, let's see which way your foot goes. So her toes are kind of going in, so she doesn't have any neuro issues, because usually if the toes flare out, that's indicative of the Babinski sign. So she has that intact. The last thing we're going to do is we're going to check for clonus. So I'm going to have you lay down again. And what we're going to do is I'm going to lift your foot up, and I want you to hold it there for, let's say, 10 seconds, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Perfect. With clonus, that'll usually like drift down. So that does it for all of your muscle strengths. Next, just going to double check that's everything. Yeah, please. Okay. Next, we're going to do your reflexes, so you can sit up for this one. So there's a few reflexes that we're going to particularly look at, and the first one is going to be your biceps reflex. So what you can do is have the patient like relax their arm. Well, let's try it like this. And you are going to, well, it's going to be really hard to have you relax your arm. And maybe look that way, so you're not, so what happens when you hit the biceps reflex is that she is going to kind of flex her arm like this. Okay, and then when you do the triceps reflex, it's the opposite. I'm actually going to just remove these pillows because they're even more in the way than anything. In the triceps reflex, she's going to actually, her arm's going to go down more. All right, the brachio radialis reflex is going to be right here, and with that one, what's going to happen is her hands are going to kind of like come inward. All right, one finger went in, so I'm going to say that is a success. Okay. Then we're gonna do your knee reflex. She's kind of tall, so we don't really have much of a dangle here, but for her knee, we're gonna hit like kind of underneath the patella here. Sometimes you just need to mess around with her foot so they let it be a little bit. She's a little ticklish, so that's not particularly helping us. Okay, we got a response. All right, the next one we're gonna check is the Achilles reflex, which is right behind her foot back here. And with this one, she's gonna kind of, there you go, flex against my hand as well. And all her reflexes are present. All right, so I'm just checking those. Those are really perfect. Okay. All right, perfect. We already checked the Babinski, so we won't do that one again. And we already checked the clownness with the muscle strength. So now we're going to do the cranial nerves. All right, so for this, I'm just gonna get some of my supplies ready. All right, so our first nerve is the olfactory nerve, which has to do with smell. So you're gonna check patency of the nerves. You're just gonna like check for symmetry. We're also gonna do that later in the nasal portion of this video. So I'm going to have you close your eyes and plug one of your nostrils. And I'm gonna have you tell me don't look, what you smell.
Can I smell it again?
She has a cold, so.
Oh God.
Yes, okay. Now you're gonna do the same thing, plug the other nostril, and you're gonna tell me what do you smell.
Oh God.
Unfortunately, I don't have much else to do this with, so. Okay, So her first cranial nerve was intact. The second cranial nerve we're going to do is your optic cranial nerve, which you usually will do with the Snellen test, where you're checking to see if she can read the Snellen chart. So I made an improvised chart. So what I'm going to have you do, Isabella, is close one of your eyes or put a hand over it, and I want you to read that smallest line that you're going to see over there.
A-B-O-M-N-F.
Wonderful. I'm going to have you do it with the other eye closed and read the smallest line that you can see over there.
A-B-O-M-N-F.
Perfect. So that is going to be 20/20 vision. Wonderful. And you will also do the visual acuity, so maybe just read what it says right there.
Cerebellar RA assessment.
Okay, cerebellar assessment. Very good, as well as so her visual acuity, her nearsightedness is intact. All right, next what I'm going to have you do is I'm going to have you cover one of your eyes, and I'm going to cover the same eye, and we're going to check your confrontation, so your visual field. So you want you to look at me and tell me when you see my fingers.
I see them. See them.
Okay. Other side. You can tell me when you don't look at my fingers now. Tell me when you see them.
I see them.
When you see them wiggling.
I see them. I see them.
Alright, she obviously has very good peripheral fields. So that does it with cranial nerve 2. Cranial nerve 3, 4, and 6 are all tested together. So your ocular motor, your trochlear, and your abducens are all tested at once. So what I'm going to have you do is I'm going to have you follow my finger, okay, without moving your head. Okay, great. So that is intact. Next what I'm going to do is check for perla. So I'm just going to have you look at me. And I'm checking for consensual pupil restriction in both eyes. Wonderful. Now I'm going to have you look at that chart. And then when I tell you, I want you to look at my finger. Ready? 1, 2, and 3, look. Beautiful. So patients, pupils are equal, round, reactive to light, and accommodation. And that does it for cranial nerves 3, 4, and 6. So then we have cranial nerve number 5, which is your trigeminal nerve. So what I'm going to have you do is I'm going to have you close your eyes, and I'm going to have you tell me where you feel me touch you, and if it's soft or if it's pointy.
On my forehead. Pointy. On my nose, soft. Cheek soft. Other cheek pointy. Chin pointy.
Okay, wonderful. So that's your trigeminal nerve that we're going to test there. Now we're gonna do your facial nerve. So this one's a fun one. This is also where you would do a taste test, but I don't have anything for her to taste other than the alcohol swab, so we're gonna forego that. So the next thing you're gonna do is you're gonna smile for me really big, frown, puff out your cheeks, keep them puffed out. Don't let me blow the air out. Perfect. Raise your eyebrows up really, really high. Squish your face. All right. That's pretty good. All right. So her facial nerve is intact. And, the next one is going to be your acoustic. So what I'm going to do is I'm going to whisper something behind you. This is called the whisper test, and you're just going to tell me what you hear.
1, 2, 3.
You should also do it on the other side. Tell me what you hear.
ABC.
Okay, wonderful. So that the whisper test is intact. Next, I'm going to do the Weber test. So I'm going to put this on your head, and you're going to tell me if you feel and hear the vibrations in both ears equally. Equal?
Yes.
Okay. So that is the Weber test. I'm going to do the Rhine test. So what I'm going to do is I'm going to put it on your bone. And when you stop hearing it on your bone, tell me. And I'll put it in front of your ear. And you tell me when you hear it again.
Oh, yeah, I hear it.
Okay. All right, we'll do the other side. Just
stop hearing it. Here.
okay, perfect. So her cranial nerve is intact. All right, next we're gonna do the glossopharyngeal. So there you're checking the gag reflex. You're looking at the uvula, making sure it's midline. And like the tonsils, things like that. So I'm going to have you open your mouth, and because it's getting kind of dark, I'm going to use this light. All right. So everything looks pretty good in there. Her uvula looks midline. She doesn't have any tonsils, so I'm going to give that as a grade of 0. Typically, I would check your gag reflex. I don't have anything to check that, but this is where you would do that. Next, I'm going to check your vagus nerve and 12, which is your hypoglossal nerve. So your vagus nerve, your hypoglossal nerve. So I'm going to have you say ah. Open your mouth a little bit more. All right, so I'm looking for the rising of the soft plate. And then I am also going to be looking for you to stick out your tongue for me, please. Move it up, down, side to side. Say light type dynamite.
Light type dynamite.
Wonderful. And then the last accessory nerve we're going to check is your cranial nerve number 11, which is going to be your spinal accessory. So I'm going to have you just shrug against my shoulders, and all her cranial nerves are intact. All right, wonderful. After that, I'm going to do a head and neck assessment. So what I'm going to do is I'm going to be looking for symmetry in her head and neck area. So just looking at me, I can tell that her head's symmetrical. You can do some palpation and just like feel around for any lumps or bumps or things like that. But she looks pretty good. Her shoulders are symmetrical. So everything seems good. I'm going to check your maxillary, your TMJ, and your frontal and maxillary sinuses. So first I'm going to check your mass eater. So I want you to just kind of clench. So I'm going to feel that, and now I'm going to check your TMJ. So can you open and close your mouth? All the way. Good. All right, good. So no crepitus, no clicking or anything like that. Next, I'm going to check your frontal sinuses. Is there any pain here?
No.
All right, maxillary sinuses, any pain? No. She does have a cold, so if she had a sinus infection, this would be painful. You also can do the illumination test for that. All right, so everything there looks really good. Next, I'm going to be checking for her trachea, making sure it's midline. I'm going to kind of palpate that. So that looks midline. She has her sternal notch. She has her angle of Louis here. Her clavicles are equal and symmetrical. A lot of times they will test your thyroid here. So I'm just going to have you turn your head to your neck to the side. Usually this is done from behind, but you can just palpate and see if it's enlarged or if there's any issues with the thyroid, which there are not. So you look really good as far as that goes. And we did that. Okay, wonderful. So now we're going to move on to your lymph nodes. So you have a lot of lymph nodes in your head and your neck. So the best way to check for like infection or any swelling or edema is to palpate those lymph nodes. So I'm just going to feel around your head and your neck. So this is your preauricular lymph nodes, your postauricular, your occipital, your tonsillar, which aren't really swollen, your submandibular, your submental, your superficial chain, your superficial cervical, your deep cervical chain, your posterior cervical, and then I'm going to have you lift, like go like this with your collarbones as much as you can, because there's some lymph nodes right behind those that also can get inflamed. You have good collarbones, and I don't feel any swelling there, so all your lymph nodes look really good, even though you're sick, so that's great. All right, next I'm going to be checking your eyes, your nose, your ears, and your mouth, and we're just doing the inspection portion here since we tested on the other stuff. So for her eyes, what I'm going to be looking at is like the symmetry. I'm looking at her eyebrows, her eyelashes, her sclera, her irises, her pupils, her lacrimal glands, her everything about her eye, the shapes of it, if they're even, things like that, for any abnormalities, which I don't see any, so they all look really good. The next thing I'm going to look at is your nose. So I'm obviously looking for the shape of the nose, the symmetry of the nostrils, making sure they're patent, which we already did that in cranial nerve number 1, and then any deviations or lumps, bumps, bruises, anything like that that's abnormal. Her nose looks really good, and obviously there are no issues in it for the cranial nerves, so we're not going to worry about that. Next, I'm going to look at her ears. So really all you can see from inspection is like the external canal, the external ear. Her ears look really good. They look really clean. Nothing really going on with that. No swelling, and nothing that I would be concerned about. You're obviously going to check both of them, kind of compare them, and you can also compare where they fall in comparison to the eyes. Okay. Lastly, I'm going to check your mouth. I know we already looked at your mouth in the cranial nerve section, but we're just going to look again. So I'm going to have you open your mouth, and as I'm looking at your mouth, I'm looking at her mucosa, I'm looking at her gums, her teeth. I'm looking at her uvula, I'm looking at her tonsils. Can you stick your tongue out for me? Wonderful. So I'm looking at everything there, seeing if there's any abnormalities or anything that is concerning, maybe like white spots, things like that, swollen tonsils, which obviously she doesn't have any tonsils, so that won't be an issue with her. Making sure her uvula is midline, that her soft plate and hard plate are there, that they rise when she says ah, and things like that. So everything looks really good. Nothing is concerning. So we're going to move on to the next part. Yeah, sorry, we did that. Okay, so we're going to do, I already did the cardiovascular portion and the blood vessels portion, so I'm going to skip through that since I tested out on that in class. And I'm going to start with the anterior chest. So when inspecting the anterior chest, what I'm going to do is obviously look for landmarks. So you're going to start with your inspection. So you're looking for the landmarks. We already talked about this earlier, but I'll go over it again. So you're looking at your trachea, your sternal notch here, your angle of Louis, and your costal angle, which should be about like 90 degrees. Everything looks good. You're looking for symmetry on both sides. I'm just going to palpate, like feel around your chest to see if there's any pain or any tenderness. Is there anything that is painful or tender? Okay, wonderful. So then that's the palpation portion. While I'm here, I'm going to just put my hands like this, and I want you to take a nice deep breath in. All right, so I'm doing the thoracic expansion test. I'm also assessing if she has her A&P diameter, which looks really good. So it's 1 to 2. So you're assessing for barrel chest, which usually is seen with like COPD patients and things like that. So she looks really good. So we did our palpation part. Now we're going to do our auscultation, because you don't percuss on the front part of the chest. So I'm going to listen to her lung sounds. So when I put this on you, I'm just going to have you take a nice deep breath, okay? Okay, so the front part of her chest sounds really good. There's no adventitious sounds, no crackles, no wheezes, nothing that would be considered important. So that does it for the anterior part of her chest. Next, we're going to do the posterior part of her chest. Same thing, we're going to kind of just inspect. So just spin this way for me. So I'm inspecting that her spine is straight, her shoulders are straight, her scapulas are there, everything's symmetrical. I'm looking at finding her C7 all the way down to her T1, kind of following those vertebrae all the way down, making sure they're straight. She looks really good. Next thing I'm going to do is just let me know, is there any tenderness or pain?
No.
Okay. Well, I'm going to have you take a deep breath, thoracic expansion test here as well. And that looks really good. Next, I'm going to have you say 99.
99, 99, 99, 99.
Okay, perfect. And that I'm just checking for similarities and vibrations on both hands and both sides. And that sounds really good. Next thing I'm going to do is I'm going to percuss. So this is a little bit strange, but I'm going to percuss and go across her back. Alright, and you're listening for resonance there, and it sounds really good. You don't hear any dullness. If you do, it might be bone. So that's really good. Next thing I'm going to do is take a listen to her, the base of her lungs, which are primarily located in the back. So I'm going to have you take a nice deep breath. All right, and while I'm here, can you please say E?
E.
One more time.
E. E.
So that was the Goffany test, and you should hear E. If you hear A, there might be some kind of consolidation. So everything sounds really good. Again, no adventitious sounds, wheezes, or anything like that, that crackling that we should be concerned about. So as far as that goes, that is perfect. Now we're going to do the diaphragmatic excursion test. And basically that is, I'm going to have you kind of lean over, and I'm going to use a piece of tape to kind of mark. So I want you to just take a deep breath in. All right, let it out again. We'll try this one more time. Ready? Take a deep breath in.
Do I hold it?
And hold it. All right, you can let it out. So I'm just going to kind of put a piece of little tape there. All right, now I need to take a deep breath in and blow it all out. All right. So then you usually measure this, and could be up to like 7 centimeters. I have inches here, so I believe, or no, this is centimeters. So this is about like 6 centimeters, so that's normal for the diaphragmatic expansion test. That does it for the back posterior chest. The last thing we're going to do is the abdomen, and then we're going to be finished with assessment. So for the abdomen, I'm going to have you lay down, please. So this is like your stomach area. All right, so the first thing you're going to kind of assess for is obviously like Turner's or Cullen's sign, which you're going to see is bruising like on the side or by the umbilicus, which I can peek, but I don't think you have anything. No, you're good. Okay, so you're going to first do inspection. You're kind of looking at the stomach, seeing if there's any odd bulging, like anything that's abnormal, like any freckles, things like that. You want to keep a close eye on if there's scarring, things like that. Just document. I think that's pretty much the important thing to hear. Okay, so after you do that, you're going to take a listen first, and then obviously you're going to tell the patient and let you know if anything is painful or hurts. So you're going to listen to all 4 quadrants. Right, so she has bowel sounds in all 4 quadrants, which is normal. Next, I'm going to listen to the liver and more closely to the spleen to see if there's any friction, Rob. So I'm going to be looking in the right upper quadrant and listening carefully. I don't hear anything there, and I'm going to be listening in the left upper quadrant. Nothing there. All right, then I'm also listening to the renal artery. Spleen it. And we're listening to the iliac arteries. And then the femoral, which are down here. And you would also listen to those on your patient. All right, after that, okay. So the next thing I'm going to do is percuss. So we're listening for dullness over the spleen areas. So that's a dullness, and this is over the liver, so that should be dull. You would hear more dullness over the spleen as well. Okay, perfect. All right, after that, we're going to estimate your liver size. So I'm going to have you sit up again. This is a little more harder to test in women, but typically you're going to go down and you're just going to percuss. And you're kind of listening for where the dullness ends. All right, and you can take a deep breath, so that way the liver gets pushed down. Okay, and there's not much of like a difference there. The liver shouldn't really come down that far from that costal ankle, but it looks good, and it's within normal range. So that's our estimated liver size. All right, then we're going to check, while you're here, we're going to check CVA. I usually check this in my cardiovascular when they're sitting up. Do you have any pain when I hit there?
No.
Okay, wonderful. So you can lay back down. And at this point, I'm just going to feel your stomach, checking for any pain, any lumps, anything like that. So we do a light palpation each quadrant. Are you ticklish?
Mm-hmm.
She's okay. She's keeping it together. All right, now we're going to go a little bit deeper.
Oh, no.
Here, give me your hand. We'll do it with you. Ready? Because when you do it on yourself, it's not as bad. Okay, perfect. So nothing abnormal there. Next, I'm going to be checking her liver. I'm going to be checking her spleen, and I'm going to be checking both of her kidneys. So I'm going to have you take a deep breath in. I'm going to stick my fingers into there. I know. They shouldn't be palpable. Same with the other side. Ready? Take a deep breath. All right, should not be palpable. Next, I'm going to do kind of this duck maneuver and feel for the kidneys. So I'm going to push up. Hard to feel, but I'm also going to do it on the other side. Wonderful. Okay. All right, lastly, I'm going to check the aorta. I believe we didn't have to do this, but like you could just percuss and kind of, or palpate and kind of feel it there. But for these testing purposes, we're not going to test the aorta. And lastly, I'm going to check your Bloomberg sign, and this would be positive if you had appendicitis. So you would put your fingers in the right lower quadrant, right between the belly button and your iliac crest over here, and I'm going to press down. And when I let go, that rebound should cause pain. Does it cause pain for you?
Yes.
It does?
Oh.
Alright, that's okay. She's getting tired. It's been a long day. We'll try one more time. Let me know if that causes pain. Ready? Alright, well that concludes our head to toe assessment. Thank you very much, Isabella, for being a wonderful patient, and thank you.